sir, would you be able to tell us, because you mentioned earlier, okay, there's like, as we all know that we follow DSM manuals, and for screen addiction to be formally have a diagnosis, and in DSM manual would be a pointer that we would want to know, because I don't for our audiences it is not really clear. Is there is an established diagnosis of screen addiction in DSM, or is it just a myth?
Basically, like I said earlier, that it is a contemporary issue. It is emerging, especially it has emerged in the last decade. So it has not made its way to the DSM or ICD-11 yet, but one out of it, like internet gaming addiction, that has made its way to, that is mentioned, that is classified as behavioral addiction in the DSM and in the ICD-11. However, the concept of screen addiction, the screen use is it is very relevant in the field of psychology and psychiatry. So instead of a distinct diagnosis, screen addiction can be conceptualized within the framework of other behavioral addictions or impulse control disorders. For example, individuals may exhibit symptoms similar to those seen in substance use disorder, or like we addressed that in the first question as well, the key signs and symptoms, which includes preoccupation with the screens, loss of control over the usage of the screen, withdrawal symptoms, tolerance, and personal neglect. So all the symptoms that are exhibited in other addictions, chemical and non-chemical addictions, are same in the screen addiction. So soon it will be classified, it will be included to the DSM-5 and ICD-11, but right now it is looked upon in the general framework of other behavioral addictions, because it shares the similar symptoms and the similar signs of other addictions.
Amazing. So, sir, how could if someone is facing this issue or is vulnerable to developing screen addiction, how could someone analyze, that they have become or are vulnerable to becoming screen addictive?
Exactly. So self-analysis or even a diagnostic by a professional would be done on the basis of on the diagnostic criteria of other addictions, because to understand screen addiction, we need to understand addiction. And to understand addiction, we need to understand the mechanism of brain. So they can self-analyze themselves, or they can be diagnosed with the same criteria of other addiction, like substance use disorder, or behavioral addiction like gambling, like sugar addiction, like internet gaming disorder. So the criteria for the diagnosis of screen addiction will be the same as for other addictions. Like, first of all, they can check, they can analyze themselves, that are they preoccupied with the screen use, even like, are they thinking about the screen time even when they are doing something else? So are they preoccupied? Number one. Number two, are they developing tolerance in the screen time? Is their activity or time spent on the screen increasing with the day? That is another thing that they can analyze themselves on. Then the third is that, is it affecting other aspects of their life, like social health, mental health, relationships, work, school? If those activities are being affected by the screen use, this is another symptom of screen addiction. And withdrawals, when they are trying to cut down the screen time, or when they are trying to give up altogether the screen time, do they exhibit symptoms of irritability, anxiety, depression, restlessness? This is another symptom of screen addiction. So through the criteria of other addictions, it can be diagnosed, and one can analyze himself for the screen addiction.
All right. I think we've talked about now, and we are, I think, clear on, that screen addiction is not just a myth or is not just a stage talk. It's actually, an established fact that it's present, it's prevalent. So, sir, what to do if someone is screen addictive? Are there any specific treatment approaches or interventions for individuals struggling with screen addictions? Or could you share any examples, because you are an addiction psychologist, right? So, could you share some examples of your own, like, from your own career as a mental health practitioner, in this regard?
Yes, yes, yes. We have had many cases of screen addictions like gaming addiction, PUBG की भी हमारे पास cases आए हैं. We have had addictions, cases of addiction, gambling, screen addiction के, pornography addiction. So many internet addictions के हमारे पास काफी cases आते हैं. And of course, it is treatable and it can be treated. So there are many treatment modalities for screen addiction, starting, for example, the most famous and favorite is CBT, cognitive behavioral therapy. Now, the CBT is widely regarded an effective treatment for various forms of addiction, not only screen addiction, including screen addiction. CBT help individuals recognize and challenge unhelpful thoughts and behaviors related to the screen use, develop healthier coping mechanism, and build self-regulation skills. A study which was published in Computer and Human Behavior, they demonstrated that CBT led to significant reduction in screen time and improving psychological well-being among individuals with the screen addiction. So one, CBT. Then another approach, a very effective approach, is mindfulness-based intervention. For example, mindfulness-based intervention, which focuses on increasing an individual's awareness of their own thoughts, feelings, and bodily sensation in the present moment. So this has also shown promise in treating screen addiction. These interventions can help reduce impulsivity, and it can also increase self-control over the screen use. There was a research conducted in the Journal of Behavior Addiction found that mindfulness training was effective in reducing compulsive internet use and enhancing emotional regulation among participants with high levels of screen addiction. Then if the people who are suffering from screen addiction are children or adolescents, then family therapy is also a very effective way to treat screen addiction. Involving the family in treatment can be particularly beneficial. So family therapy can address underlying family dynamics that may contribute to screen addiction and provide parents with strategies to set appropriate boundaries around screen use. So a study, again, in the Journal of Child and Family Studies, highlighted the effectiveness of family-based intervention in reducing screen time and improving family communication and relationship. So this family involvement in the addiction treatment and the family therapy has proven specifically in our line of work, like we use, usually most people are suffering from drug addiction, alcoholism, or other behavioral addiction. So family therapy has helped us a lot in treating those individuals, those come with different kinds and different forms of addiction. So family therapy is another very effective tool to treat it. Then another is the digital detox and technology management tools, basically. So digital detox programs, which involves taking a break from digital devices for a set period, can help individuals reset their relationship with technology. Additionally, technology management tools such as apps that monitor screen time, we all have it in our phones, but we never look at it. So there are apps that monitor screen time or block access to certain sites during specified times, can support individuals in controlling their screen use. There are many empirical studies on digital detox interventions are still emerging. And anecdotal evidence suggests that they can provide temporary relief and a starting point for more sustainable changes in screen use behaviors. So digital detox, digital literacy, this is also a very effective approach towards them. Then another very important factor is lifestyle modification. We encourage participants in alternative activities such as physical exercise, hobbies, social engagement. These activities can help reduce reliance on screens for entertainment and stress relief. Engaging regular physical activities, in particular has been shown to improve mood and reduce symptoms of anxiety and depression. When we contract our muscle, when we exercise, so actually when we contract our muscle, we pump those feel-good chemicals directly into our bloodstream, our bloodstream. So I always tell people that, you know, our muscles are actually feel-good chemicals producing factories, natural factories हैं हमारे पास. जब हम exercise करते हैं तो those chemicals they get into the bloodstream and we feel good. जैसे runners high एक terminology बड़ी famous है. Runners high means people who do jogging or running, they experience the same rush and euphoria as people experience it from morphines and opiates. So lifestyle modification is also a very effective way to treat screen addiction. So there are so many. Basically, if we look at our brain, neuroplasticity, it is plastic, right? So neuroplasticity, the neurons that fire together, they wire together. So when we repeatedly do these healthy activities like exercise or running or games, different outdoor games, and we do it repeatedly for a certain period of time, then neural units and new neural circuits are emerged in our brain circuitry, and the shape and function of the brain automatically changes. So these are some of the effective treatment tools and methodologies for treating screen addiction.
Amazing. I guess, I do believe that you have actually very, in detail have highlighted the practical strategies a person can use to reduce their screen time and break the cycle of addiction. But what is screen addiction? How does it intersect with your mental health issues, such as like anxiety and depression that we had already discussed? Are there any other form of mental health issues that are, that intersect with this sort of addiction?
Many, like I said earlier, all the behaviors that we display or exhibit actually stems from a chemical structure of the mind. Some chemicals are higher than the others, and that result, for example, impulse control. Now, there's a part in our brain which is called orbitofrontal cortex, and one of the function of orbitofrontal cortex is to inhibit inappropriate behaviors, not to produce appropriate behaviors, just it inhibits inappropriate behaviors and will allow the behavior, only the behavior which is appropriate. So with screen addiction or any form of addiction, what happens to the OFC, that its functionality comes down to almost 50%, and then we are not able to inhibit those inappropriate responses. So, लोग कहते हैं यार इसको क्या हो गया, ये तो ठीक ठाक था, अच्छा भला था, अब ये किस तरह का बिहेव करता है, बदतमीज हो गया, जवाब दे. So what those changes, those visible changes in the behaviors that that people exhibit with screen addiction or other form of addiction is basically the result of the changes in the brain circuitry, which comes in different key parts of the brain, like orbitofrontal cortex, like the dopamine system, like the endorphin system, like the stress system in the brain. So that is why so many changes in our behavior and many changes in our functioning are actually the results of screen addiction and other forms of addiction.